A short video on Xofigo Radium-223 Dichloride IV used by Sanjeev Bagga, MD. Xofigo or Radium-223 Dichloride is an alpha particle-emitting radioactive agent. Radium-223 has a half-life of 11.4 days. Xofigo is used to treat symptomatic patients with castration-resistant prostate cancer with bone metastases. Radium-223 behaves like calcium. It gets into areas of increased bone turnover. It kills cancer cells by its alpha particles. It should not be used if the disease has spread to the visceral organs. It improves overall survival, and there is a decrease in the PSA or prostate-specific antigen and ALP or alkaline phosphatase levels. The dose regimen of Xofigo is 1.35 microcuries per kilogram body weight given at 4-week intervals for 6 injections. It is administered by slow IV injection over 1 minute. The IV access line should be flushed with isotonic saline before and after injection of Xofigo. It causes diarrhea, nausea, vomiting, decrease in platelet counts, leading to increased bruising and bleeding, fatigue, and increased susceptibility to infections. The patient should drink extra fluids. The patient should use bathroom frequently in the first 48 hours. The patient should sit on the toilet to avoid splashing and flush the toilet at least twice. The administration of Xofigo is associated with potential risk to medical staff and caregivers from radiation or contamination from spills of urine, feces, or vomit. Medical staff should use gloves and barrier gowns when handling blood and body fluids to avoid contamination. In case of contact with skin or eyes, the medical staff should flush the affected part immediately with water. When handling body fluids, caregivers should wear gloves and wash hands. Clothing soiled with Xofigo or patient fecal material or urine should be washed promptly and separately from other clothing. Radium-223 is primarily an alpha emitter. 95.3% fraction of the total energy is emitted as alpha particles, 3.6% is emitted as beta particles, and 1.1% is emitted as gamma radiation. The external radiation dose exposure associated with handling of patient doses is low. Xofigo or Radium-223, an alpha emitter, is used to treat patients with symptomatic bone metastases who are castration-resistant. It is given in a dose of 1.35 millicuries per kilogram body weight every 4 weeks. A total of 6 injections are given. It causes low platelet and white blood cell counts, hence these need to be monitored closely. Universal precautions and standard radiation precautions should be observed by the medical staff and the caregiver.